Okay, so as we discussed with the life cycle of the patient, the first step in all of this is to fill out the new patient form. Now, yes, technically, you could add in a blocker appointment into the schedule instead of a real appointment, but let's ignore that for now. We'll talk about the actual schedule app later on. So, here is how the new patient form looks like. It's a simple website that works both on desktop computers and on mobile devices. It has three different languages: English, Portuguese, and Espanol. They all work the same with just the different languages. And for today, we will go in English. So this can be customized for whichever practice, including the name and telephone number and email address. But the overall method into getting the information is more or less the same. So here comes the very important question: are you in pain? Now, if the patient is in pain, then we want to treat them very differently if they're just looking to get a simple exam and cleaning. So let's first talk about the pain. So the website will ask the patient specifically about said pain. How long ago did the pain start? Where is it? Which is actually pretty useful. For example, if it's an anterior tooth, you want to get different forceps ready as opposed to a posterior tooth. Are they even looking to save the tooth? So, yes, I'm looking to save the tooth, but if they have no interest in saving the tooth, then you want to get things ready for an extraction. If they do want to save the tooth, maybe you want to get things ready for a root canal. It all depends on how they fill out this form, exactly how you want to set up the operatory. So this way, there are no surprises. You already know why the patient is in the chair. And then how soon can you come in? They can come in today or they can't come in today. You have a better idea of like, okay, is this pain really bad that they want to come in as soon as possible, or can it wait another couple more days? So these are the type of questions I will be asked if they are in pain. Now let's go back. Hitting the back button, it will give you a little bit of a warning saying like, hey, first you were asking that you're in pain and now you're trying to reset all that, but not to worry, this only happens if you hit the back button. But anyway, let's pretend that we are not in pain. So, I'm not in pain. Do you have any issues? So this is what we would call the chief complaint. So they have no real issues. If they say that, most likely they're just looking for an exam and cleaning. That's it. Or if there's anything in particular that they want to get looked at, they might say, yeah, I have no real concerns, but I want my teeth to look better. Any issues, so they can get their level of anxiety. When was their last cleaning? This is also important in terms of knowing when they are due for a cleaning, because sometimes they just had their cleaning done at a different office and they're coming to you for, let's say, a second opinion, or they want to get more than the 2 cleanings that are allowed by their insurance. So then you have an idea of like, okay, they have to pay out of pocket for the additional cleanings. And then, have they ever had a scale and root planing done, or also known as deep cleaning? If you know that they had a deep cleaning recently and they still have deep periodontal pockets, you know at that point that additional scale and root planing is not going to be too useful. So you know you have to go to periodontal surgery or simply just refer the case to a specialist. And then how often do you brush? How much do you floss? This will be useful in terms of getting a good periodontal diagnosis, like moderate gingivitis, severe gingivitis, headaches, just to see if there's any TMJ issues. Do you smoke? Do you grind at night? See if there's any requirements for a night guard. Braces before, so you have an idea of like if their misalignment is due to a relapse or if they just never had any kind of orthodontic treatment before. And then you have people at night. We want to screen every patient for possible sleep apnea. So we want to at least ask them, hey, do you wake up in the middle of the night gasping for air? That is always a good question to ask. And then we ask the patient their actual information. So we can just say, John K. Doe. We can say, okay, my name is Johnny, male, and then this is for any kind of transgender patients, so that way we can use the proper pronoun. What is their date of birth? 1970. Race and ethnicity. This is actually more required if you are a public health facility, but they can put in there. How did you hear about us? So that way you know whatever marketing that you are doing is effective. Home Street. I can say Maine. And then you can get their phone number, cell phone number. And then you can even get a preference of how they want to be contacted. Do they want to be called? Would you rather be text? Would they rather have email? And then which of the numbers, so we can get all of their numbers and then find out, okay, they actually like to be text message each time. So, all right. And then when are they available? So they can get a preference on which days and then at what times. And then you can actually also preemptively get information about their dental plan. So they can say yes, and then they can put in something like Delta Dental, and then something about their subscriber number, and then even information about their secondary if they have one. And then to prevent any kind of situations where before we can even do a cleaning or any kind of extractions, it would be nice to know ahead of time if the patient needs to have any kind of antibiotics before the procedure. So we ask them in the new patient form. Also, if they have a history of cancers, they may have had head and neck radiation as well, in which we have to limit the number of radiographs we can take. So if it says yes, what kind? So was it somewhere in the kidneys, or was it more of the actual in the head and neck area? We just wanted to know that ahead of time. So I'm going to say no. And then the system will do a review of systems. So it starts off with blood. It gives a couple of examples, but the patient can put in other just in case. So they can say, yes, I have heart murmurs, high blood pressure, and then something else on top of that, and then the doctor would review that of the patient. They could just say no to any of those things. No, 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 no. I'm making the assumption that the patient will actually read all of this. And then what medications you are on. So some medication one, and then some other medication. Any kind of allergies to know ahead of time. So if they're allergic to amoxicillin, you know not to actually prescribe that. So I can just put in something like clindamycin. And it can actually say, like, I don't know, because it's actually a very common response when you ask them. It's like, okay, what kind of reaction do you get? And they said, yeah, just my mom told me I'm allergic to penicillin. I don't know. So, and then this is a nice free form because sometimes the patient wants to say something about themselves before they actually see the doctor. So, I can't lay down. Really hurts. Really something like that. So that way the doctor knows ahead of time, okay, don't put the patient lying down all the way. But they can put this, basically anything that they want. And then standard consent form, they can just sign like this. And then it gets imported to the new patient module. And that is it for this video. Next, we'll go over the actual new patient form. I'm sorry, the new patient importer, which is kind of straightforward. All it really does is grab the information from the website and then puts it to the official database. And then from there, you can call the patient and schedule them for the new appointment. And that is it for now. Thank you for listening to all of this.